Most people think painful sexual intercourse is just something women have to endure, or that it is simply all in their head. If you have ever felt this way, you are completely wrong, and you are not alone. This is actually a very real medical condition, and more importantly, it has proven treatments. By the end of this video, you will know exactly why this pain happens and the actionable steps you can take to fix it. Let me explain what is actually going on in your body. When you come to the clinic for painful intercourse, as doctors, we first figure out where the pain originates. We divide it into two main types: superficial pain at the vaginal entrance and deep internal pain. Let's start with superficial pain, which is felt right at the entrance. One of the most common causes is vaginismus. This is an involuntary spasm or tightening of your pelvic floor muscles. It is not something you are doing on purpose, and it can make penetration incredibly painful or impossible. These pelvic muscle spasms often happen as a subconscious response to triggers like fear or anxiety. Many women are completely unaware that their body is clenching up. This can affect your ability to have intercourse, use tampons, or even undergo a basic speculum examination at the doctor's office. Other superficial causes include vulvodynia, which is a chronic burning pain, or common genital skin diseases like eczema. Sometimes, something as simple as severe dryness from menopause or common vaginal and urinary tract infections can cause microscopic tears that make intimacy extremely uncomfortable. Now, what about deep pain that is felt internally during or after penetration? A major culprit here is endometriosis. This happens when tissue similar to the lining of your womb grows outside the uterus, attaching to your ovaries or bowel, causing severe inflammation and deep pelvic pain. Deep pain can also be caused by pelvic inflammatory disease, or PID, which is a serious infection of your upper reproductive organs. Structural issues like a retroverted uterus, uterine fibroids, or swollen pelvic veins, known as pelvic congestion syndrome, can also make deep penetration very painful. What most people do not realize is the severe psychological toll this takes. It is not just physical pain. It leads to immense stress, relationship strain, and even depression. Many Malaysian women suffer in silence for years, feeling embarrassed or broken. But you are not broken. Here is the really good news. Conditions like vaginismus and dyspareunia are highly treatable. The most important thing is breaking the vicious cycle of pain and fear. When your body anticipates pain from past experiences, it automatically rejects penetration, which just causes more pain. Breaking this pain cycle involves several medical approaches. In the clinic, we often prescribe anesthetic numbing gels to apply at the vaginal entrance alongside safe muscle relaxant medications. In some persistent cases, we even use specialized Botox treatments to relax those involuntary muscle spasms. A highly effective, safe treatment involves using vaginal dilators. These are medical devices that come in incremental sizes. Used gently at home with plenty of lubricant and deep breathing exercises, they slowly train your pelvic floor muscles to stretch and relax without spasming. It is also incredibly important to involve your partner in this healing journey. Honest communication is your best tool. Even while you are working up to penetrative sex, there is absolutely no reason to stop being physically intimate. A supportive partner makes all the difference in treatment. Here is what I tell my patients. Do not wait. If you experience persistent pain during sex, especially if it is accompanied by abnormal discharge, fever, or unusual menstrual bleeding, you need to see a doctor as soon as possible to rule out serious infections. To prepare for your clinic visit, pay attention to your symptoms. Ask yourself, does the pain happen right at the entrance or deep inside your tummy? Does it happen with certain positions? Sharing these exact details helps your doctor pinpoint the exact cause much faster. As a daily preventative step, avoid using harsh soaps, hot water, or scented feminine hygiene products. These disrupt your natural pH and worsen skin dryness or irritation. Stick to gentle, unscented washes. And remember, your sexual health is a crucial part of your overall well-being. You do not need to suffer in silence. Book a consultation with our female doctors at Klinik Temasya today. This video is for educational purposes only. Please consult your doctor or visit your nearest clinic for personalized medical advice. If you have questions about this topic, leave them in the comments and share this with someone who might find it helpful. If you found this useful, check out our video on managing PCOS and hormonal changes.